You know that feeling, right? When you can just tell a fever is creeping in? We've all been there. But have you ever really thought about when that super common symptom crosses a line? When it goes from, I should probably rest, to, I need a doctor now. Well, that's exactly what we're going to dive into today. It's a huge question, isn't it? Is this just my body fighting off a bug, or is it a serious warning sign? Knowing the difference is absolutely critical. So let's get into how you can start to tell. And to really get a handle on this, we're going to use a specific condition as our case study, pelvic inflammatory disease, or PID. Now, this is an infection of the female reproductive organs, and yeah, a fever is a super common symptom. But as you're about to see, not all fevers are created equal. The kind of fever is what changes everything. All right, so let's break it down. What exactly is the difference between a pretty standard expected fever with PID and one that's a massive flashing red flag? Well, it really all comes down to the numbers on the thermometer. So on one hand, you've got your typical fever for PID. We're talking somewhere in that 100.4 to 102 degree Fahrenheit range. Low grade to moderate. Annoying for sure, but expected. But then, you look at the other side. A fever that hits 104 degrees Fahrenheit or higher, that's not just a symptom anymore. That's your body screaming that something is seriously wrong. So what's so special about 104 degrees Fahrenheit or 40 Celsius? Well, in the medical world, that's the threshold. That's the tipping point where a fever stops being just a routine sign of infection and becomes a critical alert. It's a sign that the body is in a major battle against something way more serious than a standard infection. Okay, so why is that number such a big deal for clinicians? Let's decode what a high-grade fever is really trying to tell us and why it demands immediate, urgent attention. Medically, this is what's known as a high-grade fever, and you can basically think of it as your body's 5-alarm fire bell. When a doctor sees a number that high, especially when it's paired with something like abdominal pain, it's an immediate signal to start looking for a serious problem right away. So what could this alarm possibly be signaling? Well, the first major possibility is that the PID itself has gotten way, way worse. We're talking about a whole new level of severe. This isn't just your run-of-the-mill infection anymore. And severe can mean a couple of really nasty things. You could be looking at a tubo-ovarian abscess, which is a collection of pus forming in the reproductive organs. Or it could be peritonitis, an inflammation of the lining of your entire abdomen. Both of these are incredibly dangerous and need immediate medical intervention. But a nasty localized infection isn't the only possibility. That high fever might also be a sign that the infection has broken loose and is now causing a crisis throughout your entire body. And that body-wide crisis has a name: sepsis. This is when your body's immune response to an infection goes completely haywire and starts attacking its own tissues and organs. A high-grade fever is a classic textbook warning sign for sepsis, which is a true medical emergency where every single second counts. Okay, but here's the curveball. There's a third crucial possibility that every doctor has to think about. What if that dangerously high fever isn't being caused by PID at all? What if it's a completely different problem that just happens to look similar at first? And the list of those other possibilities is, well, it's long and it's serious. We're talking about things like appendicitis, a life-threatening ectopic pregnancy, or even meningitis. Or it's possible you have a second infection going on at the same time, like a severe UTI or pneumonia. This is exactly why a full, proper medical evaluation is so critical. You just can't make assumptions. So, with all these potential dangers flying around, how do first responders on the scene even begin to figure out what's happening? Let's put on our EMS hats and see what they're trained to look for. Paramedics basically have a rapid-fire checklist of red flags. First up is the temperature at or above that 104 mark. Then they're immediately on the vital signs. Is the heart rate way too fast? Is the blood pressure dangerously low? Both are potential signs of sepsis. They'll also check the pain. Is it severe? Does the patient guard their abdomen? And then they look for other systemic signs, like vomiting or fainting. Finally, a huge one, is the patient confused or acting strangely? That can mean the infection is impacting the brain. It's a fast but incredibly thorough assessment. Now, if a patient is ticking off these boxes, the protocol is crystal clear. They are immediately treated as a potential sepsis case. That means lights and sirens, an urgent trip to the hospital, and constant close monitoring the whole way. There is absolutely no time to waste. All right, so we've covered a lot of ground. What's the single most important thing to walk away with? Let's boil it all down to the bottom line. If you remember just one thing from this entire explainer, please make it this quote right here. Yes, PID can cause a fever, but a fever of 104 degrees Fahrenheit or higher means you have to start thinking this is more than routine PID. You've got to think severe infection, an abscess, or even a completely different diagnosis. That is the crucial takeaway. So we've seen how fever, something we all experience, can be a critical warning sign. It really makes you stop and think, doesn't it? What other supposedly common symptoms are out there that we really ought to be paying more attention to? What else might our bodies be trying to tell us? Thanks for tuning in.